Hello, I'm Bill Faulkner, and welcome to the 2018 SMRT Safety Video Podcast. This series of videos is produced exclusively for the SMRT for MR Safety Week 2018. In this second video of the series, we're going to take a look at something called specific energy dose, often referred to as SED or SED. Now, the specific absorption rate, or SAR, differs from specific energy dose, or SED. So before we discuss SED, let's review SAR. SAR, or SAR as it's often called, stands for specific absorption rate. It's specific to the body part and the tissue. It's related to the absorption of the RF into the body and the tissues. It is a reflection of the rate at which RF energy is absorbed by the body, by the tissues, and it's in units of watts per kilogram. So when we place our patient in the magnet and we apply RF power into our patient is going to release that RF energy by cooling. Now, if the input is greater than the output, then heating is going to occur. SAR, or SAR, is the rate at which energy gets deposited into the body. The NEMA standards state the following. It's not considered prudent to raise the core temperature in a patient above 39.2 degrees Celsius, roughly a 2.2 degree rise from thermoneutral. If a patient exposure to radio frequency magnetic fields during an MRI scan is insufficient to produce a core temperature rise in excess of 1 degree Celsius and localized heating greater than 38 degrees Celsius in the head, 39 degrees Celsius in the trunk, and 40 degrees Celsius in the extremities, then RF heating is considered to be within safe levels. Now, RF heating, or RF-induced heating, is more peripheral. It's primarily due to magnetic induction, and there's very little deep body heating. The IEC provides standards for exposure to RF. The normal operating mode is the mode of operation of the MRI equipment in which none of the outputs have a value that can cause physiologic stress to the patient. First level controlled mode is defined as the mode of operation of the MRI equipment in which one or more of the outputs, and by this they mean either RF or the switched gradient fields, will reach a value that can cause physiologic stress to patients, which needs to be controlled by medical supervision. Now, with regard to the RF, because that's what we're focusing on, our limit in clinical imaging is 4 watts per kilogram. But for whole body SAR, the normal operating mode would allow us only to go up to 2 watts per kilogram. So 2 watts per kilogram or less when scanning in the normal operating mode for RF. In this mode, no physiologic stress is expected. The other clinical operating mode is first level controlled mode, and for whole body SAR, again, that's 4 watts per kilogram. So first level control mode will allow us to go as high as 4 watts per kilogram. But in this upper level, it's important to remember that physiologic stress in some patients is possible. The SAR for head, whether it be normal or first level controlled, is less than or equal to 3.2 watts per kilogram, and in that mode, no physiologic stress is expected. Patient cooling is influenced by quite a few factors: the bore temperature, the ambient temperature, the relative humidity of the room, the airflow rate. These are environmental conditions. And whole body SAR limits will be deregulated by about 1/4 watt per kilogram for each degree Celsius above 24 degrees Celsius that the system senses the air temperature to be. So as the room temperature, bore temperature would increase at some point, the software is going to start derating the SAR so that you do not expose the patient to excessive RF energy for which they're unable to dissipate that energy or cool. Cooling is also determined by perspiration and blood flow, and this, of course, is very patient dependent. On Dr. Frank Shellock's website, MRIsafety.com, he writes the following: various underlying health conditions may affect an individual's ability to tolerate a thermal challenge, and this would include cardiovascular disease, hypertension, diabetes, fever, old age, and obesity, a small subset of your patient population, I'm sure. And in addition, medications that include diuretics, beta blockers, calcium blockers, amphetamines, and sedatives. These can also alter a patient's thermoregulatory response to a heat load. So it is very important to understand that when you are scanning patients who are, shall we say, a bit on the fragile side, that have these conditions, they're likely not going to be able to dissipate heat as efficiently as someone that's healthier. So you should really take this into account if you make the conscious decision to scan greater than 2 watts per kilogram. Okay, so that is SAR. And SAR is estimated per sequence. So you could scan every sequence at 4 watts per kilogram. SED, or specific energy dose, which, by the way, may also be referred to, and I've seen this more in scientific literature, referred to as specific absorbed energy. But from breaking the term down of specific energy dose, it's specific to the body part and the tissue. It has to do with the energy of the RF, and it's the total dose to the body. The SED is in units of watts per minute per kilogram, or that translates joules per kilogram. Essentially, this is the cumulative dose of RF energy deposited into the body over the course of an MRI exam. So once again, SAR is the rate at which energy gets deposited into the body. It is specific for each scan, and it is estimated for each scan. SED is the total accumulated amount of energy that gets deposited into the body. So you can think of SED as equaling SAR over time, or times time. One of the good examples that I've seen of this in the past uses the illustration of a bucket of water and a tub. Now, if this tub represents my maximum amount of energy level that I'm allowed to deposit into a patient, that is to say the SED or SED, then the bucket would represent each individual scan in this study. If I were using 2 watts per kilogram of RF per sequence, that would be a smaller bucket compared to 4 watts per kilogram per sequence. Obviously, the greater the amount of RF energy per sequence, the quicker I would reach the maximum, the quicker I would fill that tub up. And there is a temperature max above which we are not allowed to go. So if you were to plot in a vertical axis the energy, SED, or the temperature, and the longitudinal axis, scan time, if you were using lower RF power scans, then you would not reach that limit as quickly. The higher the RF power you are using per sequence, the quicker you will reach that maximum. Based on research published in the Magnetic Resonance in Medicine Journal in 2014, there are certain limits that are defined for SED and SAE. 100 watts per minute per kilogram, or 6,000 joules per kilogram, is looked at as the level that above which patients with compromised thermoregulation may suffer physiologic stress or even tissue damage. And this is based on research published in this paper. To my knowledge, I am not aware of any papers to date that have been published showing tissue damage, human tissue damage, from clinical doses of RF that we use in routine MRI imaging today. Nonetheless, these levels have been adopted by the IEC. So patients who are compromised in their ability to tolerate a thermal challenge, as we previously discussed, it may warrant limiting the amount of time that we spend scanning these patients because of the theoretical possibility of the physiologic stress or even tissue damage. To my knowledge, all the vendors today, especially on the newer software past a certain point, they were required by the IEC to display the SED information. All the vendors do that, but they do it in slightly different ways. Some just show you a graph or color chart as it rises. Others will monitor it. And Siemens, for example, in this particular interface, once you reach or are about to go over 6,000 joules per kilogram with your next sequence, it shows you a message, as you see here, courtesy of some friends of ours that sent this to us. And it says, if you'll notice, that the patient has been exposed to accumulated energy dose of 5,937.61 joules per kilogram. The next measurement is going to rise the energy dose to 6,271.36 joules per kilogram. Then they give you this statement. To avoid harm to the patient, it is strongly recommended to stop the examination now. If you nevertheless decide to continue the examination, the patient must be closely monitored to avoid unacceptable thermal stress. For further details, consult the operator manual under specific energy dose. There's that other term. And it says, do you really want to continue the examination? I'm not going to get into a debate as to the appropriateness of this message, but understand that this is in the user manual for this particular vendor. So I believe that sites which have this vendor and do occasionally see this message, I recommend strongly that you create policies and procedures for how to proceed beyond this point. Perhaps you just get a radiologist involved and take a look at the patient's condition, what you're doing, what you have left to do, and decide how to handle it. But I do think if you're getting a message like this, you need to have some policies and procedures that clearly define for every operator what to do in this circumstance. At 240 watts per minute per kilogram, or that's 14,440 joules per kilogram, once this level is reached, your system will stop scanning for that patient, and you would not be allowed to continue any further. According to the research, and again, this is an IEC requirement that the system stop, the research shows that this level will produce a temperature rise to 43 Celsius, which is 109 degrees Fahrenheit, above which patients with normal thermal regulation may suffer tissue damage. So again, this is based on this research, and as I said, I am not aware to date of any published literature which has shown patients having tissue damage due to RF exposure from an MRI exam. Nonetheless, this is an IEC requirement that the system stop scanning this patient at this point. To my understanding of the three vendors that we spoke with at the last RSNA meeting, this means 24 hours. So you would not be able to enter in that same patient ID for a 24-hour period. And so, again, while these limits may be controversial, the maximum limit, 14,440 joules per kilogram, is an IEC standard. You can't go past it. And I, again, believe that all sites need to have very clear policies and procedures on how to handle this. That is, assuming that your system is at a software level, which is displaying the SED information. And that's the end of the second video in this year's SMRT Safety Week video podcast. Be sure to keep an eye out for the next video in this series. And until next time, this is Bill Faulkner. Thank you again for watching, and take care.